Welcome to this fifth video. This will be focused on action planning and thinking about your work going forward. It's the final video in this training course. The learning objectives for this video are to support the application of the concepts we've learned from the previous videos to your country context and work, and to prepare you to develop your own approaches by providing ideas for what steps you could take in your work going forward. And it will be split into 5 different sections. The first, on starting out. The second, deciding who to target and finding your allies. The third, deciding on the best tool to use. Fourth, using the data to support advocacy. And fifth, general principles that will be useful going forward. So first, starting out. How do you set and stay focused on your goals? You can choose to either focus on the biggest gaps or lean against an open door. Where are you most likely to have success and make a significant difference? These are 2 different approaches which are both equally valid and depends on whether your context is broadly supportive and you can see that there are easy wins to make, or if there are really urgent and important gaps that cannot be ignored. It's important to be focused in your goals. There are many issues that need addressing, but you will not be able to tackle them all in one go. So a good rule of thumb is to pick a maximum of 5, but ideally 2 to 3 to focus on changing. And this helps to avoid having a shopping list. Having too many priorities can make your advocacy appear poorly thought through or not focused. So it's important to start by defining the change you want to see on each priority issue that you select. Look at the reality. Think about, what does success look like for each of these issues? What can be achieved in 1 year's time when you review? Or you could set the timeline slightly differently, but try to visualize what that will look like in your time window. Here are some example advocacy priorities that might provide some inspiration for you. You could look at expanding the availability of HIV testing, improving communication and awareness campaigns to increase demand for that HIV testing, or objectives to promote and protect human rights and getting those costed in HIV strategic plans. To move through the process of setting your objectives, you can rank priorities in order of importance, and this can help you to select what to address first. You can look at this through the lens of what is most urgent, or what is most important, or what is most strategic, or something that meets all 3 of those categories. It's important to provide a rationale for each priority to say why you have selected them and help you understand why it's important. I've given an example here, where the advocacy priority is to ensure that treatment monitoring is effective by providing viral load test results promptly. And the rationale for this is that among 10,000 viral load tests performed at facilities undergoing community-led monitoring between January and June 2018, just 2,500 were returned to the recipient of care in 2 weeks. Community-led monitoring data shows there's a connection between faster turnaround times and better treatment outcomes. So this is quite a detailed rationale, and it makes it clear why this advocacy priority has been set. Next, you want to look at setting short, medium, and long-term goals once you've picked your advocacy priority. And a concept note can help you with setting those goals by focusing on answering some critical questions. Think about, what are the primary objectives? What barriers do you want to monitor and why? Which populations and interventions will you focus on? And will you monitor issues in one disease, or will you look at a broad integrated approach? Stop TB Partnership has an investment package as a helpful planning tool, which you might find useful to refer to. You can also look at which other organizations are already implementing community-led monitoring, and you might want to align with that or focus on gaps that they're not looking at. To set your goals, think about, are they smart? Are they specific? Are they measurable? Are they achievable? Can you achieve them with the current resources that you have? Are they relevant? Are they going to contribute to progress? Are they timely? Is there a deadline that you need to meet? Will you get the data in time for that? And here's an example from ITPC, again, on a goal that is time-bound by 2025, attainable, setting the deadline of 4 weeks, measurable, setting how they will frame that measurement within 2 weeks, specific, then noting the audience, so this could be trans people, or intersex people, or gender diverse people, and it's relevant. So saying how it's going to contribute to progress by reducing the average turnaround time for viral load tests. We're going to move on to the second part of this last video, deciding who to target and finding your allies. It can be really helpful to map who the decision makers and power holders are. I've included a quick power mapping tool on the right hand side here where you can map who is the most influential or powerful against how supportive or oppositional they are to what you want to change. And it's important to identify who holds that decision-making power over the thing that you want to change and focus on identifying the individual. So not just say the Ministry of Health, but who is the Minister for Health, who has that decision-making power. Next, you want to establish your target audience. And you can map this for who your target audience is for sharing and discussing your data, and who needs to hear your message and act on it. So these might be the decision makers. They could also be people that support the decision makers, such as civil servants. Consider a range of sectors as well. So government, civil society, the media, etc. You can have primary and secondary target audiences as well. Your stakeholder mapping can help to identify not just decision makers, but those who might be able to support you and those who will actively oppose you, or people who might be neutral. So for your message to be heard, you need to know who those actors are. And identifying them can help you avoid them or develop strategies to engage them or tackle them. Here's a prompt question to help you think through how this might apply to your context. And use your worksheet to respond to this question. How will you work with other organizations or communities? Are you talking to the right people? Who is missing? Now we're going to move on to part 3, deciding on the best tool to use. There are many different tools that you can use to achieve your advocacy goal, but a good place to start before thinking about this is to consider what is the core problem versus what is just a symptom of the problem. So the symptoms, if you just focus on addressing these, will not address the core problem. The core problem is the more deeper entrenched issue or needs to be addressed that will result in long and real lasting change. The goal of advocacy work should be to try and address both the symptoms and the core of the problem. And the Women for Global Fund's toolkit is a great resource to look for ideas around advocacy approaches and how to use them. And they include this helpful advocacy toolbox as a way to think through the different types of advocacy approaches that can be used once you have your data. Research and planning is about using evidence and traditional research to back up advocacy points. Mobilization is more about mass mobilization, larger numbers of people, usually through something like campaigns. Lobbying is your traditional influencing a decision maker to support or take action on your issue. Working in networks and coalitions can be incredibly effective when you have aligned interests, and this can add weight to your argument and be more effective. Using the media, this can be traditional or social media. It depends on the audience that you want to influence. So think carefully about this one. And litigation and protest can be useful when you want to enact change on specific laws. Protest can be an effective tool in making an issue visible and voicing dissent, and if you're not getting progress through other means. But to think about what tool you want to use for a particular situation, it's helpful to take a step back and think about your decision maker. What is going to convince them to take action? and what is stopping them from taking that action by themselves. This table is a helpful way to think about the different barriers that could exist. If a decision maker doesn't agree with you, you could use stories or case studies that portray the human angle, that are more emotive. If they're unaware of the issue, it might be that they need information, so you could provide this through things like shadow reports. If they don't understand the issue, showing them evidence from research, community observatories, for instance, could give them the understanding that they need to take action. If they don't have the resources, you can use budget tracking to demonstrate the gaps in the budget. And this might be the information that they need to advocate internally to get the resources. If you can show impact from additional budget, that might be enough to support them to make the change. If the barrier is that they don't have time, you can give them a quick snapshot overview, something which is impactful that communicates things quickly, like a scorecard or a citizen report card, to get your message across in the minimal time needed. It's important as well to think about the impact that you can have against the amount of resource and effort that you put into it. Is it worth the payoff? So consider the available resources that you have and opportunities for funding, which are there. You could apply for funding from donors, or could you use resources from other actors that you might be able to join up resources together? Does your team have the skills and time to implement the advocacy activities as well as gathering the data and the monitoring? There's a toolkit with detailed advice on costing out the community-led monitoring response, which is incredibly helpful, and it goes through in quite detailed level all of the different stages of the community-led monitoring cycle. And I've put the link in here so that you can have a look at this. A test question to review the learning on what we've discussed so far. What community-led monitoring tool could be used to influence a district health official to provide targeted, holistic services to trans, gender diverse and intersex people who doesn't believe that there are any barriers to them accessing existing healthcare services? These are some suggested answers, but you might have come up with something different. Next, we move on to using the data to support advocacy. As already discussed, advocacy begins by defining the change you want to see and working backwards from that. Helpful questions to support you through that process can be thinking, what is the overall change? What are the smaller changes that allow you to move towards that bigger change? And what is your contribution? What does progress look like over different time intervals? You can map entry points to consider when and where you will be able to advance your advocacy agenda. And entry points might include a particular location, a decision point, an event, or other aspects. You can take different approaches to advocacy as well, depending on how open your decision makers are to having a conversation with you. An insider approach takes a more diplomatic route. You're working very closely with decision makers and building relationships and using a lot of soft influencing tactics with things like briefings, roundtables, and joint events. An outsider approach is more confrontational, more about holding them to account in a public manner. This might be a last resort where other tactics have not resulted in the progress you want, or if the government is very closed to civil society and communities. This could look like protests, vocal accountability using mass media campaigns, and publicising data. Planning activities and expected results includes the practical aspects of what you will actually do to push your advocacy agenda. Consider the level that you want to influence at and where your change needs that decision to be made. Is it at the facility level? You would need to speak to the health facility manager. Is it the district health official who needs to make improvements? Or is the change at the provincial or subnational level? If it's at the national level, do you need to engage with the Ministry of Health and think about how they're meeting the National Strategic Plan? Or if it's at the global level, is it to do with the Global Fund or PEPFAR? Is it about accountability on allocating resources within these global institutions? Would you be looking then at the PEPFAR country operational plans or Global Fund's strategy? Here is a useful table to help you plan who to target and at what level. If you work through answering these questions, you should have a bit more of a clear idea on who that is. Thinking about where you have your change objective. Why is this a priority for you? And what is your added value in this area? Think about your targets, allies, and influences, and you can use a stakeholder analysis to map the relationships. Where could you expand that sphere of influence? What are the barriers to engagement? Who is already working here? Who could we align with? And what motivates and engages those targets or decision makers? Consider the opportunities and barriers. You can use a force field analysis to look at trying to neutralize negative aspects and harness positive aspects or forces. Look explicitly at barriers and how you would focus your activities in relation to those. And think about the timeline. What activities will best progress the change objective and when will these happen? Which events will you not focus on? And how will you sustain momentum over time? Lastly, think about your monitoring and evaluation. How are you going to measure progress in 6 months, 1 year, 18 months? And setting indicators is an important part of this. This can be a SMART indicator, as already discussed. You can also use spiced indicators. These are subjective, participatory, interpreted, cross-checked, empowering, diverse, and disaggregated. Using the 5 A's can also be another frame to set indicators by. This is availability, acceptability, affordability, accessibility, and appropriateness of services. Monitoring is a critical part of knowing whether you are making progress towards the change you want to see. Monitoring needs to be periodic. You can set the intervals as are appropriate to you, and you can use participatory annual reviews to triangulate the data and to draw on best practices, document the lessons learned. And you can also use these spaces to monitor commitments by decision makers. Building on the last test question, example, what advocacy approach could be used to convince a Conservative Minister of Health to include trans, gender diverse and intersex people as a key population in the national HIV response? Here are some suggested answers, but you may have come up with something different. Now for the final section of this video, we'll look at some general principles. The first general principle is around managing conflicts, and this is a useful tool for how to do that, called the conflict iceberg. And you can see on the diagram on the right, it's got 2 people, Lindsay and John, who are in conflict about an issue. And it looks at the idea of positions, interests, and needs. Positions are an initial response to a solution or situation, and what's most visible. Interest is beneath the surface. What is important to you in the situation? Your fears and concerns. You can try to find commonality in this. For instance, I want this community to thrive. We both do. Needs are the very deep base layer of the pyramid. If these are not being met, you can try to find the common needs. We both need to be valued. These can provide the answer for where points are shared and can provide a point of commonality to build from. There are other exercises to build communication skills around feelings and needs and active listening, which can also be helpful for managing conflicts. Have a look at this resource from Young Friends of the Earth. Principles of mediation can also be incredibly useful as a general approach. Conflict resolution might require mediators. And mediation can also be a way to pursue social justice. Usually this is a neutral third party, but there are different models for this. Transformative mediation is focused not about resolving the immediate issue, but trying to empower and get mutual recognition for everyone involved. So it's trying to get everyone to approach a problem with a more open mind. Compare this to problem-solving mediation. This is focused on seeing conflict as a problem to be solved and settle the dispute. The mediator leads this process and directs people arguing towards a solution. You also have insider or partial mediation. This is done by someone who is already involved in a conflict or belongs to one side of the conflict, but they are well respected by all sides and trusted to be fair, and this is critical to the success of this process. They have a close personal knowledge of the context, the people involved, and the history, and this helps the settlement process. Finally, it's important to consider mental health and resilience in working on community-led monitoring and advocacy. Taking a psychosocial approach means focusing on the impact of social and political context on the emotional well-being of activists. And this approach seeks to address these broader conditions that result in poor mental health and using collective strategies rather than putting the emphasis on the individual to counter this. It's trying to address the emotional, physical, mental, spiritual, economic, and social conditions to improve good health. Complementing this, self-care or personal care can support individuals to put in place their own strategies to manage stress, but these should be supported by organizational and collective commitments to self-care. Resilience, more broadly, is the capacity to put in place mechanisms that help activists reduce the risk of breaking down when they are faced with challenges or stressful situations. Some helpful resources that provide more information on this include GATE's Safety, Security and Wellbeing for Activists Training and resources from Protection International on the psychosocial approach. That concludes the last and final video from this training and this course. We hope that you have learned some valuable information and encourage you to now complete the post-training questionnaire to track your progress and what you have learned.